earlier when we started the show off, and I want to continue it in this hour because I want to hear from you how you feel about at least what's been revealed so far about the Obamacare replacement deal. It is a bill that is really three different phases. And what Republican lawmakers, House Republican lawmakers, are doing is they're going through reconciliation because that way they only need 51 votes to move it through the Senate. If you go ahead and propose this, at least according to what leadership, House leadership says, if you go ahead and propose a bill where you are, let's say, erasing state lines and allowing competition, and you repeal Obamacare, and you replace it, then you have to get 60 votes. But if you do it through budgetary ways, well, it's a little bit different, a little bit easier to pass. Conservatives are upset, at least a handful of conservatives in the House and in the Senate are upset because this is not a full repeal of Obamacare. This does not get government out of your health care. Forget about Medicare and Medicaid. Forget about that for me. You're not going to get government out of there at all. But this bill does not get you back to 8 years ago or 9 years ago or 10 years ago. This bill doesn't do it. There is still government regulation. There is still government, you could call them tax breaks, handout, whatever, tax credits. Government is still involved in the healthcare industry. And members of the House Freedom Caucus, very upset about that. Some members in the U.S. Senate, Republican members, are upset about it. Rand Paul leading the way. Ted Cruz has been strangely silent. Hasn't he been? Ted Cruz's big quote is, well, we need to find a path forward. We need to negotiate. Ted Cruz hasn't, old Ted Cruz. And I'm talking 2 years ago Ted Cruz. A year ago Ted Cruz. I think would have been out there blasting this deal, saying this is horrible. This is not conservatism. This is not the way we're supposed to do things. This is not why we were sent here. We were sent here for a full repeal. And his Twitter account was tweeting that just a few days ago. But he's gone a little more silent on this. Ted Cruz telling reporters that the, quote, proper way to address concerns with GOP health care bill is through working with colleagues. It's a new Ted Cruz. I'm not trying to say it's not a conservative Ted Cruz, but this is a different Ted Cruz. By the way, Ted Cruz and his wife will be having dinner tonight with Donald Trump and Melania Trump in the White House or wherever they choose to go. Probably over to the Trump Hotel. But they're going to be dining together, the Trumps and the Cruzes. Who expected that a few months ago? Put your hands down. No, you did not. But the Trumps and the Cruzes are dining together tonight. Ted Cruz is taking proper way to do it. Rand Paul's not doing the proper way. Rand Paul's out there saying there's no way in hell I'm going to vote for this. That's not the proper way. I know because I used to do that. That's not the proper way. The proper way is to say we're going to address this with our colleagues. We're going to work on this together. Don't be surprised if Ted Cruz comes out of this in a way of saying, let's bring everybody together. Let's bring the House together with the Senate. Let's bring the conservatives, the House Freedom Caucus, together with the Rand Pauls and with the Paul Ryans and with everybody else. Let's bring everybody together. That's what I think Donald Trump wants Ted Cruz to do. So Ted Cruz has not come out against the bill yet. Donald Trump has come out in favor of the House leadership bill. But the White House has also said this is a starting point. It's not going to get done today. It's not going to get done tomorrow. We want to hear from people. We want to put together a good bill. We want to put together a repeal and replace. But I'm telling you right now, if you expect the government to get out of health care, it's not going to happen. I don't have faith in anyone to do that. I don't believe it's going to happen. And that might be bursting a bubble for some folks. I wish they would. I wish government would get out of the healthcare business. I don't see it happening. This is not a president who campaigned on getting government out of healthcare. And while voters may have wanted a full repeal of Obamacare and not a replacement, I'm telling you right now, I can go back and I can pull up numerous articles of those politicians running for office and saying we're going to repeal and replace Obamacare. It's nothing new. There are some, I think it was Charles Krauthammer last night on Fox, who said things to like about the bill, things not to like about the bill. Sean Hannity last night on his show, things to like about the bill, things not to like about the bill. Republicans are in a tough spot. And here's why they're in a tough spot. They have promised for so many years now, we're going to get something done. All you have to do is give us this. We're going to get something done. We're going to repeal it. We're going to repeal it. Now, to be honest with you, they've had 6-7 years now to get together a bill that, when rolled out, should not make everybody hate each other. The fact that you roll out a bill that puts the Republican Party at war with each other tells me you had no expectations whatsoever that this was going to work or that you were going to have an opportunity to do this. But now you're here, and now Republican voters expect you to do something, and they expect you to do it quickly, and that's part of the problem. I had people emailing me just a couple of weeks after Trump was sworn in. Why aren't they doing this? Why aren't they getting it done? It's a process. And even Donald Trump says it's going to take a little bit of time. And remember, you're dealing with so many different factions. You know, there are Republicans who are ticked off at this bill because it caps Medicaid payments to the states. Did you know that there are Republicans who are upset with this bill because it defunds it prevents giving government money to facilities like Planned Parenthood who perform abortions? This bill does that. It stops paying for abortions, and you have Republicans who are against that, both in the Senate and in the House. You've got Republicans on all sides of this. Forget about the Democrats for right now. You got Republicans who can't get on the same page. And then there are the voters. You guys, us, who have been promised for years and years and years, we're going to replace Obamacare. We're going to repeal Obamacare. Obamacare is going to get repealed. We're going to see something completely different that's going to drive down costs, and it's going to save you money. And if you're in the House and if you're in the Senate right now, you're probably looking ahead at 2018 and saying, if we don't get something done, there's going to be a bloodbath at the polls. And guess who else is saying that, by the way? Donald Trump last night told Republican lawmakers, you don't get on board, there's going to be a bloodbath at the polls in 2018. Donald Trump has come out in favor of this, and it is going to be an interesting battle to see. Conservatives, are they going to really go up against Donald Trump? Folks who have been in Congress for years now, are they really going to go up against Donald Trump? Because Trump, to me, from everything that I have seen, Trump is still popular among Trump supporters. We had a couple of people who, one who called in, one who sent an email, and I got a few tweets. In Trump we trust. Let the process play out. And where I'm coming from on this, I think there are some good parts of the plan that the GOP rolled out. I see where they are wanting to go, but I also see why people are upset and they don't want government involved. I don't want government involved. But this is where I want to see, what is Trump going to do? He's been underestimated this entire time, even by me. I admit it. So, okay, this is, I want to see what Donald Trump can do. The master of the art of the deal. What can he negotiate between House leadership and conservatives? Can this bill become more conservative? Can this become a better piece of legislation at the end of the day? Drive-by was asked why the bill from 15 months ago that passed is not being used. Tom Price addressed this last night on Hannity. And if it's the same bill that he was talking about, he said that states were against it because it basically cut off all money to the state. The bill that was passed by Republicans in 2016 or in 2015, that bill was going to wind up hurting the states, that Republican governors were coming out against it, and that Republican governors would not have been happy. And I believe it would have had to meet the 60-vote threshold in the Senate, which right now, you don't have 60 votes. And the talk all along has been, well, maybe you can get some Democrats in Trump states to flip over. Donald Trump's polling numbers aren't where the White House and where the House leadership believes they should be in order to flip some Democrats. I think that's one of the reasons why they're not feeling comfortable trying to get that 60-vote threshold. If you're on hold, stay where you are. We'll pick you up when we come back because I want to continue to hear from you folks how you feel about the House leadership plan for Trump care, Obamacare, whatever you want to call it. Do you like it? Do you not like it? Do you hate it? Or are you taking a wait-and-see approach? You want to see what President Trump can do. This is what he was brought in for. This type of situation right now. 770-5790, toll-free, 1-800-687-0790. We'll be right back on the Chad Hasty Show, News Talk, KFYO. Let's go to the phones. And Brian, you're on KFYO. Hello, Brian.
Hey, good morning, Chad. Hey, you know what they're doing for me? They're negotiating how much money they're going to yank out of my paycheck and out of my wife's paycheck because I have health insurance. And here's the thing. Since Obama took over back in 08, 09, I guess, and all this stuff started, my health insurance is now more than my house payment.
Wow.
Okay? And I don't have, my house payment is less than $1,000 a month. Okay? So for my wife and I, we spend $500 a month. Our deductibles went from $250 to $2,500. And you know what? I'm not responsible for somebody else's kid who they don't take care of. What they're doing is they're taking money out of it. It's the biggest Ponzi scheme there ever was. Here's the biggest thing that nobody ever talks about in my book. Our government wastes incredible hordes of money. Incredible hordes of money. You look at what our budget is. What was the last one? Well, actually, we haven't had a budget, have we? But they're talking $3 trillion to take care of, what, 325 million people? And most of those people, or the 2/3 of those people are employed. So 1/3, I mean, the cost of government has gotten out of control. Because I don't get to tax anybody. I don't get to charge anybody different when they come into my business. I have to maintain a certain level of honesty and integrity in order to maintain my customers. That's how I make my money. And I tell you what, our government has been lying to us. This money that we spend outside of this country needs to slow down, and let's get our infrastructure redone, because a second world country is no better than a third world country, and I didn't grow up in a second world country.
Let me ask you something, Brian. If let's say they go through with Trump Care, okay, and from what you've seen with Trump Care, if Ted Cruz votes for it, if John Cornyn votes for it, and Jody Arrington votes for it, how do you feel?
I'm disappointed.
Do you go shopping for somebody else?
Why do we have to negotiate with somebody who has no standing? These are people that are unemployed. Now, you know what? The infirmed, I got no problem with that. Somebody who is really sick, but somebody that the system has been fraudulently screwed for so many years, and everybody knows somebody that's done it. Okay? I haven't done it. I hopped a championship baseball ring to eat when I had no money. I didn't go to the government because I was too proud. I was proud that I didn't have to ask somebody for money. Now it's a freaking honor that if you get $700 a month from WIC and $300 a month from this and $500 a month from that, and then my son I have two sons. One is a liberal. One is a Republican. One paid for his kids, and one used the system to pay for his kids. Now, you tell me which one is the one a Republican and which one is the Democrat.
I got you, Brian. Brian, thank you.
Have a great day.
You too. 770-5790, toll free 1-800-687-0790. In this bill by House Republicans, it does bring back the catastrophic plans. You're not required to get insurance. However, insurance companies do have to cover pre-existing conditions. Now, while you're not required to have insurance, if you decide, hey, I need to get insurance real quick, then your premiums, if you go 56 days, 60 days without insurance, then they say that you've lapsed. And so you could pay an extra 30% on your premiums. Now, that's not the government punishing you. That would be the insurance company punishing you, even though the government's allowing it to happen. But no one's going to force you to buy insurance under this plan. You just should expect to pay higher whenever you do need insurance, which to me is better than what the Democrats have. Chad Hasty Show, KFYO. We'll be right back. Let's see. Let's go to the phones. We'll be talking about Obamacare and the replacement for Obamacare. And Tom, you're on KFYO. Hello, Tom.
Hello. Hi. I've got just a few quick comments here. The first one is that, in my view, I'm a physician here in town. We think about this all the time. It's revising Obamacare rather than repealing it. That's what they're doing. They're revising it. It's a lot like that 80s movie Poltergeist, where we're building on top of a graveyard of bad ideas and just moving the headstones, not really digging things up to actually fix things. And the other thing is I hear all these people argue, we need a working system. We had one. 07, 08, it was working. And they said, well, you got to cover the poor. Well, Obamacare didn't do that, and Medicaid covers the poor. They're covered. And, I've written off up to $250,000 in 1 year. I mean, we take care of them, and the problem was solved. It just wasn't solved by government, and that's why they're bothered by it. And the last thing is what we face is what all industries face, is the overregulation. And probably the main one that I think that nobody's talking about, but that's on our minds all the time, is the meaningful use legislation. And that forces computerized medical records. They are terrible. They've been implicated in a lot of errors, and they're one of the main reasons for older physicians wanting to retire early. They just can't take the computers, and it forces us to be inefficient. You could have a more efficient, less expensive system with your doctor seeing you earlier in the office if you isn't forced to fill out these online forms. I mean, every time a woman comes in for a mammogram, we got to weigh her. They hate that. What's your weight, ma'am?
Right.
Are you smoking? Do you have guns at home? All these stupid questions that we don't even really ask. And they think they're getting data, and all they're doing is making people want to quit.
Tom, let me ask you something. We've had Obamacare for 6 years now, 6 years plus. Do you think we can get the government out of health care? Not talking about Medicare, Medicaid. I'm not talking about those, but out of health care, the insurance industry, do you think we can get government out of it?
Before November of last year, I would have said no. But I was shocked as could be when I saw Trump get elected, and I think the nation's waking up. And I have to wonder if my answer would change now, because I was really surprised.
But he doesn't want
Hillary lost.
But
so if we can beat Hillary, I'm starting to feel a little confident about at least paring it down, get rid of regulations.
Yeah. Okay.
Don't build on a graveyard of bad ideas. You're going to be haunted by it. That's how I see it right now. They're not, and I think we got to get behind our politicians. We got to give them permission to be obstructionists, to change the plans. And I think just a wave of support and say, yeah, man, do whatever it takes. And, before Trump, I would have thought no. But with people waking up and putting him into office, I'm starting to wonder if we can.
But Trump doesn't want government out of healthcare, right? I mean, he's never said that.
The bill. It's going to have to be from Congress and from the Senate.
Yeah, and right now, I just think Donald Trump, he's got more pull right now than a Ted Cruz. He's got more pull than a Rand Paul.
He didn't. He's trying to keep his promises. He didn't say revise and replace. He said repeal and replace.
Yeah, but he also, but remember, we're talking about Donald Trump, who also said in numerous interviews, everyone is going to be covered by what we replace it with. I don't want people dying in the streets, which is another liberal talking point, where I don't want people dying in the streets. Everyone's going to be covered. Everyone's going to be able to keep their doctor. I mean, this is from the White House, where Donald Trump has said this. So
I hear you. That's the bad side of him. The good side of him, he seems like the kind of guy who can change his mind. First he was going to ban all Muslims. Now it's just people from Muslim nations. So I see him as a guy who comes out full force, but then comes back to reality. I think he's a realist, and I think if from bottom up it gets pushed to really fix things.
So you're a wait and see. You're in the wait and see category on this bill, right?
I'm a push like crazy and then wait and see.
Gotcha. Okay, Tom, very good. Appreciate your call today.
All right, thank you. Bye bye.
And I think people have to remember with Donald Trump was never a guy who was going to completely repeal Obamacare. He wasn't going to do that. He gave so many interviews. Go on YouTube and look them up. Donald Trump always talked about how everyone was going to be covered because everyone in the media was asking Donald Trump, are you going to leave people out of the health care system or out of the health insurance system? No, everyone's going to be covered. At one point, it almost sounded like he was going towards single payer. And then I think Republicans went, whoa, hey, buddy, come in. You got to come back on the ranch. Come here. We can't go down single payer. That's bad. That's very, 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 very bad. Again, this bill is not perfect that the House Republicans put forward. It is not the most conservative piece of legislation we have ever seen. But this is something that Donald Trump has had his fingerprints all over it. House leadership does. And this is what they think they can get passed. Now, I do think, and I hope, that Donald Trump will bring in the conservatives and say, okay, what can we do to make this even better? Because you can. You can make this bill better. Donald Trump is having dinner tonight with Ted Cruz. Wouldn't surprise me if one of the topics of conversation is health care. Ted, what do you think we need to do? You've been a leader on this. You've been someone who's promised everybody that we're going to repeal and replace. What have you been hearing? What do we need to do? That conversation will probably, if it hasn't already, it'll probably take place tonight. Jody, is it weird I'm defending Trump and saying wait?
No, it's not weird at all. No. Got to play the cards you're dealt.
I look at this. I look at this administration. If you wanted a full repeal of Obamacare, you should have elected Ted Cruz or Marco Rubio. You got Trump, and Trump was someone who consistently campaigned on, we're going to take care of everybody. Even Carl Tepper, who called in, said, I was going to be pissed no matter what. I'm going to be unhappy no matter what. Because I think Carl, I'm with Carl, we would love to see, and with our guest yesterday, Ryan Ellis, who said this is a conservative plan. This is a good conservative plan that the House Republicans put out because it gets rid of Obamacare taxes. It doesn't force people to buy insurance. It expands health savings accounts, which is something Republicans have always pushed for. And it brings back catastrophic plans. It's a good plan. Is it the most conservative thing we've ever seen? No, because we're still involved. Government is still involved in health care.
Yeah, just like I told you this morning, it's not what I would prefer, but that's where we're at.
And
hopefully they can negotiate some good points to it.
I hope so, and I hope that if this is the way we're going, I hope phases 2 and 3 do get kicked in. Right now, I'm still going to take I'm going to wait and see what Trump does. He has surprised me at every turn. So I'm going to give the guy a chance and say, okay, but let me tell you this. If Republicans screw this up, and there's a multitude of ways they can screw this up, but if they screw this up, whether they don't pass anything at all, or they pass something where premiums still go up, there's going to be hell to pay for these Republicans. And not only that, I think you have one chance. Now, I think you can pass something, and if things start working out better, I think you can come back in 2 years and go, we're going to chip some more off of this. We're going to chip some more off of this. We're going to keep coming back and chipping more and doing it incrementally. I think Republicans could do that. If we start seeing premiums start dropping, people will be happy. They'll have more money to spend. Everybody's happy, happy, happy. But if this doesn't work and premiums continue to skyrocket and people are still losing money, the road we're going down is single payer. That's the next step. You screw this up. Republicans screw this up. They either don't do anything at all, because then Obamacare fails and Republican voters either stay home or they find people who are beatable, whatever. Democrats come back in charge, you're going to a single-payer system. So that's why this has to be correct. This has to be right. And this is why good negotiations must happen, because the next step, if Republicans fail, is single-payer, and that will be a disaster for this country and for health care. Chad Hasty Show, News Talk, KFYO.